A lot of people are familiar with the term porcelain veneers, but not everybody knows what the advantages are of porcelain veneers. So we use veneering for a number of different reasons, but primarily we use it to change the color, the shape, or the alignment of the teeth if the patient's unhappy with the current situation they have. For example, if a patient has worn off incisors and the teeth look short and wide, we can actually use a veneer to lengthen that tooth and bring it back to its natural shape and proportions. And the advantages of the veneers once we place them is they do add a lot of strength to the tooth by grabbing the front of the tooth and wrapping the edge, basically improving the integrity overall long term. We use a lot of veneering where we don't remove any tooth structure at all or very minimal tooth structure, and that's actually the best scenario because when you save tooth structure, or once you remove it, you can never get it back. We like to preserve as much as we can, but when we preserve that tooth structure, the bonding process is much stronger and much more durable. So I think one of the confusing things out there right now is that people think when you have a porcelain veneer you have to grind the tooth down, but that's actually not the case. It's beneficial to the patient and the doctor to grind very little tooth structure away for as little as possible to get the veneer job completed without making the teeth too bulky. Nobody wants chiclets or super white, bright, fake looking teeth. They want a natural result. Sometimes a little bit of reduction is required to get the veneer to look right, especially if there's rotations or the teeth are flared out or there's something that requires correction of the position. But I would say in most cases nowadays we're making the veneers very thin, within 1/2 millimeter to 3/4 of a millimeter thick, or sometimes even less than that, and very little grinding, and we get a long-lasting result. We can pretty much predict that veneers will last anywhere from 15 to 20 years or longer if the patient takes care of them, comes in for the recalls, wears the bite guard if indicated, and just has good brushing habits at home. So veneering is a really wonderful technology that can add strength and beauty to the tooth very conservatively, and it can last for a very long time.